Good evening. This is your host, Deborah Stanley, and once again, it is time for truth-telling time. Time for us to tell our truths according to us. We are going to embark on a conversation this evening about HIV, the new cases in our state, how we need to respond as a community, and the plans that we have for to engage the entire community in this conversation. I have two wonderful, glorious people who have agreed to join me in that conversation this evening. So I'm going to lean back for a moment and allow them to introduce themselves.
So my name is Carrie Lawrence, and I'm from the IU School of Public Health Bloomington Rural Center for AIDS STD Prevention, as well as the project director for Project Cultivate at the Rural Center for AIDS STD Prevention.
All right, thank you.
She's a doctor.
Doctor.
Carrie Lawrence. My name is Tony Gillespie. I am the Public Policy Director, Public Policy and Engagement Director for Indiana Minority Health Coalition, a statewide coalition, a statewide organization with coalitions in 25 counties around the state. We specifically target health disparities and chronic disease issues that disproportionately impact minorities, and certainly HIV is one of those.
And this is my personal doctor. When I am in crisis, I'm having a mental health moment, this is who I call. Well, thank you both for joining us this evening. We'll just start with your project. And so, tell us all about this project.
Well, Project Cultivate came about as kind of a response to just knowing how to navigate, for communities to know how to navigate developing a conversation or developing even the proposal required by the state to begin some sort of syringe exchange program locally. And so what we saw as a need was not to necessarily offer technical assistance or training, because there are great organizations in our state that offer that, as well as nationally, but to help bridge folks to those resources. And so we've been building resources between the organizations and the local community members who are asking for specific information, and just kind of offering support as they go through that process and what that looks like. And that started from even our work around exploring HIV care systems, specifically looking at linkage to care in the state of Indiana, what that looks like today, and keeping people in care as the I would say the societal shift of what HIV looks like today versus when we first were dealing with it has shifted. And so what does that mean for Indiana? So that's kind of what Tony and I have been working on together for the last year.
What a wonderful project, because today HIV AIDS is all about living. All about living, and people can live very well. And it is so critical that they be linked with that whole continuum of care. There are wonderful, wonderful treatments available for folks living with HIV to reduce the amount of virus in their bodies, but then all the other things that are critical to them staying healthy. Housing is having the right doctor, not just a doctor, but the right doctor. Those who are well versed in HIV, as well as primary care. And you know, because there was a young doctor at our last Women in AIDS conference, and he was just so amazed that now, for the people that he is treating for HIV, it's all the other health issues that they have to be concerned about, you know, not so much the HIV. And so what is your role, Tony, in the project?
Indiana Minority Health Coalition, we're part of the advisory or the leadership council for the project. But just from a historical perspective, IMHC, through our research arm, we funded a number of research studies where we looked at HIV systems of care. Carrie made a reference to the Linkage to Care Project, which is a survey-based look at what the issues are around HIV care, not only for persons living with HIV, but family members, providers, to try to understand everyone, to try to understand what care looks like now, what care should look like, what services are available, and how can we use that information to retain folks in care. There's a whole, and you mentioned the continuum of HIV care, there's a whole process in a person accessing HIV care and remaining in care, and remaining well and living well and having not only the HIV treated and becoming undetectable, but then having all of the other chronic health conditions dealt with, living longer. There's a whole continuum that goes along with that. So we've, through our research arm, we funded that project. Last year, or year before last, we funded a project where we wanted to look at the readiness of our community health centers around the state to provide sexual health services, HIV and STD services. Fascinating project, and we found that largely our community health centers either were not ready, were not interested, or just didn't see their place in the HIV continuum of care. And I think from both you and I, Deborah, we've done a lot of work at the statewide level. We know that federally qualified community health centers or primary care, they haven't been our partners at the table. And I don't think it's for lack of desire. I think that the process wasn't inclusive of them. So part of what we're doing now with Project Respect is we want to go around and work with communities to create these safe spaces, to have community conversations, to do engagement with new partners that really should have been old partners, but the new partners because we haven't worked together before, and to really find out 30 years plus, what does HIV look like in your community? And the opportunity really came out of what happened in southern Indiana, the international incident that happened in southern Indiana with the outbreak. How do we turn that into an opportunity? Well, an opportunity is one, we need to talk about it, we need to make sure that it doesn't happen again, and it's also an opportunity, as Carrie said, to provide information and resources around understanding the new legislation. Now needle exchange actually can take place legally in Indiana versus some illegal process or illegal needle syringe exchange program. Understanding the process, understanding what communities need to do to access that process, and understanding who the partners are that you need to bring to the table to develop that process.
Thank you. This is a very exciting project, this whole cultivation of relationships, because I'm so into social health. and you know, it is still hard to understand that the health centers, you know, don't see their place at the table. Because how I got involved in the whole HIV issue was working at a health facility. Now, I was hired for the social health stuff. I'm not a medical person. But finding that they treat gonorrhea, chlamydia, diagnose herpes, genital, all of these things. And so they are very good at treating, giving the shot. But lips closed, tightly sealed about any kind of prevention or education. And so they see the same people over and over and over. So I would think that they would be a grateful partner at the table, because they do need the help and the support.
I think though that kind of goes back to what we're trying to do, in that recognizing if there is a deficit with one aspect. So if education is it, and the role of the what we perceive as the role of the provider is not necessarily how they perceive it, then who else is willing to fill that gap? And I think that's where we are trying to shift away from saying, well, okay, we're not going to continue this program, or we're not going to continue this effort as a result of our funding stream has stopped from the government, or our whatever has been a limitation, an unsustainable resource has been a limitation. Why does it have to be? I think looking at more innovative and creative ways to meet what the needs are, and that's kind of where this morphing of the projects that Tony and I have worked on is that we're not just going to send out a survey to kind of survey the people. We also want to see what things look like when we bring everybody together and
Right.
talk about what we're learning and
Absolutely.
sharing information, because you
Right.
don't know what you don't know. And until you provide that engagement and build that trust and have those hard conversations, it's hard to really look at what change really could be and how it can sustain regardless of what's going to happen.
And then let me say, with our community health centers, not in that they don't see or not that they don't want to participate, in that HIV for 30 plus years has been HIV in its own stigmatized way.
Exactly.
Special aid service organizations that were charged to provide special AIDS, HIV/AIDS related services, and just treat it as its own separate entity. And that's been the practice. So very much at the community level, it's been STDs and then HIV. So for HIV, they get shipped to that organization. For everything else, we can treat. And so now we just have to do something different. Or our colleague, Dr. Beth Meyerson, always says, now we just have to ride a new bike. We have to do something different. HIV is, while it is a need for pre and post-test counseling, while it is a need for case management and wraparound services, that doesn't change. But facilitating the partnerships to reach folks that won't go to an AIDS service organization, that won't go to a health department, but they will come to a health center.
Right.
How do we reach them? And then for the health center that's interested in providing those services, how do they become HIV service providers? What are the training that they need? What's the funding that they need? You know, what's the difference between the OraSure and, you know, all of the things that we as HIV service providers have known and done for so long.
Translate it.
Translate it. We
Translate
need
it,
to
right.
translate this information to new partners. We need to build new partnerships.
I mean, and really, if you think about it, and I think Tony said it well when he said that, you know, we've always done this. We've always had these specific organizations that do this work around
Right.
HIV, and now we're saying, no, actually, community health centers, you can do it too. And if we're really kind of using the language that we've heard lately around medical care, primary care in general, about developing a medical home in a medical neighborhood, then what does that look like with folks who live with HIV, and why does it need to be this separate entity, and how can things be more integrated?
And so with part of the national HIV health strategy, strategy that they're trying to shift HIV into
Chronic disease.
Chronic disease.
Well, not necessarily chronic disease, but just like testing. Make it a
Routinized.
part
Make it a routine.
of
Routine.
routine, you know,
Health
that everybody
service.
gets the test
Yep.
for HIV. And so is that part of what you guys are formulating, that whole movement to take HIV from this isolated, stigmatized area and move it into the realm of health, period,
Yeah.
and connect all the...
I think somewhat. I think that you know, making it very routine to have an HIV test, because that's something that was talked about. As here, I had to go to this special place for a test, or I got tested here, but then I was asked to go to this other place. And okay, so who's the medical home in that? Whereas what would happen if it were diabetes or cholesterol or some of the
Heart
standard
disease.
wellness tests that we do on a regular basis? Could that be a part of it? Or at least get to the point where it's not so taboo to even ask.
Right.
Right.
And, you know, again, for our community health, centers around the state, you know, Deborah, you and I have done HIV community planning from the statewide level since forever, since the 90s. And there never was a community health center that participated in that process.
Okay.
And just the need to do something different.
Yes.
It's it has to happen. It has to occur. The conversation that we had this morning, we were fortunate enough to be invited to present at the HealthLink Community Health Centers. They brought all of their health centers from around northern Indiana together for their first annual conference. And we asked the question, what are some of the barriers to providing HIV care from your perspective? Whether you are a physician, whether you are a nurse practitioner, whether you're a phlebotomist, whether you're front desk, what are the barriers that you think? And hands went up around the room, and everything from the stigma of a person seeking